a breast implant or any kind of implant for that matter
foreign object
plays a role in someone's inflammation. And in this instance, chronic inflammatory processes where you have an implant playing a role, they're very complicated to unwind. And it's not that one thing you do is going to solve it. Like doing explant surgery does not solve the entire picture. And I actually did not ever believe that would solve the picture. I knew if someone had a overt implant infection, obviously that would help by removing that.
Just like you got a tooth infection, you're not going to feel great until the infection's removed.
Right. So in that basic, situation, that is a situation, a clinical situation where the patient's going to recover from that specific problem more quickly. And then I found other isolated instances where if someone had a ruptured device or if somebody's device was degrading and leaching shell contents into their system, and we've seen this on our total toxicity test from Vibrant Wellness, where heavy metals will end up in the patient's urine when you do the tox test. And we do a
wait. So that's really neat. So do you have any before and afters where you had a total tox on someone before rupture, just happenstance, and after rupture? Or
it's a great question. We do.
Okay. And you literally see the before and after.
So it's a very famous client, very famous podcaster here in Austin named Lauren Bostic, the Skinny Confidential. So that's my client.
I know that.
And she has the most heavy metals of anybody ever in the history of my practice on a total tox test.
Congrats.
So she was, and she joked about, she thought she was melting her implants when in fact the actual process is leaching. You're overheating, and I've taken a ton of shit about this on, all of the platforms, and societies have mocked me. There's memes about me about this.
Oh, that's
nice.
Fun. So you've made it when you have a meme.
Yeah. So people are like, oh, you can't melt something. And so let's just use the plastic water bottle. Like if we leave the plastic water bottle out and it gets too hot, the phthalates from the plastic go into the water, and we drink the water and our phthalate level goes up. It's not super complicated to think that
it's pretty logical.
You overheat yourself, then those shell contents can leach out into the system.
Every chemical reaction happens faster as it's heated, so that's just logical. Yeah.
So anyway, I just have moved on from that, understanding that, we have the information. It's not rocket science. I will say, I think it's helped a bunch of people and they ask me like, oh, well, how do you know that's happening? Well, I tell it this way. If you have a patient who has a IR sauna or a barrel sauna or whatever, if they feel worse after the session, that would be your body saying, that's basically like a Herxenheimer type reaction.
Right, exactly.
So I just tell them like, okay, just stop.
Listen to your body.
Right. Just don't do it. And then people ask me like, well, when do you suggest, resuming sauna? So for my patients or patients who want to get into our ecosystem, we just have you suspend sauna until you work with us and do your explant. And then about 90 days after, our team will reintroduce that. And certainly if somebody has an autologous fat transfer, I get asked to do fat transfers simultaneously to that. The heat effects associated with maintaining a fat transfer are, to me, a little bit difficult to forecast. So like in the advent of saunas that you can get, easily at home,
right,
and GLP-1s, which we can talk about, you could easily get now. I have a lot of people ask me like, what about, a GLP-1, so tirzepatide, semaglutide. You can't take those things and maintain your BMI because they all work.
Right.
They work.
Right.
So, and the concept of microdosing, which there's no data on microdosing.
That's all extrapolated down.
When people ask me about it, I'm like, whoa. There is no data on that. And so,
but it's popular, so it's out there.
Absolutely. Now you got a glimpse of my life when we were in the same, kind of workspaces, but it's just gotten more complicated.
Job security, right? So go back a second, because there's a couple questions in there that I'm sure people are watching, because we have both patients and doctors, practitioners watching. And so number one that goes back is, what is breast implant illness? Like, what are the symptoms? Is this every woman with implants should be considering this? or are there specific symptoms? It's never specific in medicine. So tell us
I look
what
at
the
breast
common things are.
Yeah, breast implant illness to me is just a chronic inflammatory process
Okay.
of which this
And you
person
have
has
implants.
an implant.
Yeah.
You can take the implant out and you've seen just as many symptoms in somebody without implants. So then it boils down to like, you didn't pick your parents right. You didn't grow up in the right place. You didn't eat the right foods. You
we were
got
just
bad
picking on
water.
Floridians. Yeah,
You, from an air standpoint, think of air quality.
absolutely.
Very compromised air quality can affect you.
The
So
hidden chemicals.
all these things are, the bucket analogy, right? Okay,
Yep.
you can detox so much. That's a genetic capability you inherit from your parents. And then everything else, the inputs into the system dictate the balance. And when you're out of balance, you become more symptomatic. That's kind
and
of
more toxic.